be a perfect time for everybody all around the world at the same time, right? So we just are going to optimize for this at this point. And of course, our speakers are already in the room, and we are looking forward to having a wonderful session with them. Before we go right ahead into the meat of the matter, the main event for today, the panel session, I'm going to invite Miss Olutola Vivian Awoshiku to give us the welcome address. She is the founder and operations manager for Digital Health Africa, which is the mother organization under which the Adhpn belongs. Vivian, over to you.
Can you hear me?
Yes, we can hear you. Vivian, can you confirm if you can hear me?
Yes, I can hear you. All right. Good afternoon, everyone. Depending on where you're joining from, I trust we've been having a great day, and we are really excited to have you on board to gather to really discuss this important topic today. I believe that digital health innovation across Africa is really reshaping how we deliver healthcare, how we assess healthcare, and the quality of healthcare services that we have. I won't go into all the different examples and applications of how digital health has created new possibilities to enhance our health services, to make it more efficient and accessible to communities across the continent. We've been witnessing this growth, and the landscape is rapidly evolving. But then we need to really ask ourselves critical questions. Yes, we have beautiful ideas, we have beautiful applications. AI is the reigning thing right now. It's really exciting, honestly, and we are witnessing this growth scale by scale. But we need to really address governance issues because at the end of the day, this is where the bulk of the leadership really is. If you look at the seven enabling environments for digital health, by the WHO, you see that leadership and governance is the critical one, is at the top. So you can have all your beautiful ideas, have everything in place, but if we are lacking in leadership and governance, it brings a challenge then of how do we scale all of these beautiful digital health interventions across board, both nationally and regionally. How do we ensure we have consistent data privacy framework in place that is continental wide or even adopted, at different countries, right? How do we enhance cross-border collaboration and really establish that supportive environment for digital transformation in Africa? So today, our team really emphasized the critical need for us to really align digital advancement with African values and priorities, as well ask ourselves questions on how do we achieve the balance that will require, robust governance, ethical data practices, policies that protect the citizens' rights, and also that encourages innovation. We are at the Africa EdTech Summit, few days ago, and we asked questions around policy, governance, government. Some of our government agencies, they are threatened by innovation, right? And they feel you want to take their job. They feel that you're too, you know too much, right? And then they feel threatened that they don't have influence over innovation. So how can we balance the fact that we are calling for healthcare professionals, young people to be more innovative, create, solutions to healthcare problems within our communities, but at the same time, get our governments to be on board or give us the right policies and regulations in which we can build within that context and really guide and ensure that digital health products, digital health interventions and initiatives are well regulated. We know where our data is going, we know who is using our data, right? We have that robust data governance and ethical practices around it. And as well, get the government to back up this innovation and not feel threatened by it. So as part of the Global Digital Health Week, we Digital Health Africa, as well as working with our Digital Health Professionals Network, we've come up with this panel to really discuss how to balance, digital governance and innovation for Africa digital transformation. We believe that this session will be able to explore how we can, advanced digital governance that not only propels innovation but also upholds the principles of equity, security, and sustainability. So we're asking our panelists, esteemed panelists who are well versed in this space, to really talk us through all of this discussion. And I hope after this session, we'll be able to understand how to align policies, best practices to create sustainable digital innovation on the continent. Thank you so much. Let's have a great time. Thank you.
Hi, thank you very much, Vivian. Can you all hear me, please?
Yes.
All right, thank you very much. Thank you, Vivian. And I really appreciate you setting the tone for this conversation. So we'll be launching into the panel session proper. As you well know, we really want to keep to time and really just, have enough time to really enjoy all of the good things you're going to be hearing from our speakers today. But I'm going to go ahead and read the citation of the speakers. But while I'm doing that, I would really appreciate if we could, engage a bit in the room, in the chat box. So you could please, Vivian, I think we can spare a few minutes to allow people to drop their names, where their country they are joining in from, as well as what they do. Because aside having this conversation, I really believe that it's not just about having talks. It should also open room for collaboration opportunities. It should open room for projects. It should open room for us to present our ideas and say, oh, outside of this event, I want to engage with people who have found something similar in what they are doing, or what they are doing aligns with what I'm trying to do, and we can both benefit from this. So I would implore us to just take some time. Let's introduce ourselves, what you do, which country you are joining in from, and maybe one or two things about what you anticipate to gain from this conversation that we have today. All right. Thank you so much. Okay, I'm going to go ahead now and read the citation of our speakers. Can I help you? You can all still hear me?
Yes.
Yes,
All
please.
right, thank you. Only one person has actually dropped their introductions. Please, okay, maybe I should just make it that if I don't have up to 3 or 5, I'm not going to go ahead and read our citation. Should I do that? All right, I have Victor Emaye from Cheka. Thank you, Khadija. Nice to meet you. Okay. We can have 1 or 2 more people. I don't think Victor should count because he's actually one of our speakers and we're going to introduce him anyway. All right, Obed from Mediating. Freddie, all right. Thank you so much. All right, let me go ahead and then do our citation of the panelists. So in no particular order, we have Dr. Adhpn Akimbo. He's a key figure in internet governance and digital transformation across Africa, and he's currently serving as the Vice President of the Internet Society Nigerian chapter. And this tenure runs to 2026. With a distinguished track record, he previously served as Secretary General between 2020 to 2023 and Public Relations Officer between 2017 to 2020. My apologies. Dr. Akimbo has been pivotal in shaping Nigeria's internet landscape as a founding board of trustees member of the Nigeria Internet Registration Association, NIRA, and he served as NIRA's executive board, where he led initiatives on policy, event coordination, and training. Beyond governance, Dr. Akimbo champions digital inclusivity through various ventures, including founding DNS Africa Media and Communications and Community NetOps Africa, which aim to drive internet accessibility and digital literacy. His work extends to the broader digital economy as the Secretary of the Association for Information Communication Technology Local Content and as a board trustee for the Africa ICT Foundation. As a communication technologist and disruptive technology expert, Dr. Akimbo is widely recognized for his leadership in internet policy, domain name systems, and local content development, making significant strides towards connecting underserved communities. Might I add that outside all of these formal things, he's actually a very artsy person. He's into poetry, and it's pretty much, by the time you listen to him, you would know that he's someone who really invests in young people and very encouraging, right, of how people engage in the digital space. So thank you so much. He's already in the room. Hello, Dr. Akimbo. Do you want to unmute and say hi briefly?
It's a big hi to the house. And I want to appreciate Esther for all the citation and everyone in the room. It's a pleasure to be here. And let me rest at that before our session. Thank you. Thank you so much, Esther. Thank you, everyone.
All right. Welcome, sir. Up next, I will be reading the citation of Victor Emaye. I'm sorry, Victor, am I pronouncing that right? You could correct me, please.
Yes, it's right.
It's correct.
Yes.
All right, thank you. So he is a prolific business leader, corporate trainer, and product manager. He's the co-founder and CEO of Checker, a digital health platform that connects people to the best verified medical laboratories around them with options of home sample collection, and digital results are sent within 24 to 72 hours. He is a graduate of the Nexus program from top business schools, Lagos Business School in Nigeria and Henley Business School in the United Kingdom. Victor has built products and worked across several sectors over the last decade, from education, transportation, information technology, and healthcare. He has been working in the healthcare sector over the last 5 years, helping over 400,000 people access healthcare in Nigeria through his platforms. Victor was awarded the winner of the Africa Regional Finals at the Founders Live Pitch 2023, and he was the second place winner at the Global Founders Live Pitch 2023. He was also named as one of the top 25 innovators in Nigeria 2023 by the Nigerian Sovereign Investment Authority, NSIA. He was also first runner-up at Nigeria's largest business reality TV show, The Next Titan Season 8, and also one of the top beneficiaries of the Orange Corners program by Faith Foundation. Wow, thank you so much for joining us, Mr. Victor Emaye. Do you mind saying hi to the room again?
Yes. It's such a great pleasure to be here. Hello, everyone. I look forward to the session.
Thank you very much. All right, and then of course, last but not the least, we have Dr. Raphael Akongbe. He is a seasoned digital health informatics, EMR, EHR, that is electronic medical records, electronic health records, telehealth, telemedicine consultant, and lecturer with over 20 years of experience working in both healthcare systems and academia, locally and internationally. He holds a BSc in Health Information Management, PGD in Health Safety and Environmental Management, DBA in Health Management Information System, PhD in Digital Health and Health Informatics, with extensive knowledge of digital health systems, health information technologies, and their applications in healthcare settings. He is an astute global conference speaker with a couple of awards to appreciate his numerous achievements. I think it's actually numerous awards, not even a couple of awards. He is a research editor and coordinator at Frontier Research Publication, one of the globally recognized research platforms. Dr. Akongbe is a research consultant at Nothing Biotechnology Research Center, China, and one of the current board of trustees of the Society for Telemedicine and Health in Nigeria. the first and current Lagos State Ministry of Health Data Protection Officer, and so on. There's so much about him. And I'm sure by the time you listen to him, you would really know that there's a lot that he has already worked on, and is currently working on and contributing to the ecosystem. Thank you again for joining us, and welcome, Dr. Raphael Akongwe. Please say hi to the house. Can you hear me?
Yes, we can hear you.
Yeah, I want to confirm if Dr. Raphael is still with us. Probably network, or if you could drop a chat. I just want to be sure that all of our panelists are well settled. All right, I guess we'll just continue then. Okay, so welcome again to the panel session segment of today's agenda. And I want you to bear in mind that we intentionally curated a list of our speakers because we want to have a very holistic conversation today. As you can see, we have someone who is into the digital technology world and actually producing products, right? That's our product manager. And then we have someone from the internet governance sector, as well as from the general digital health, health informatics and health policy through the health ministry. And the purpose of this is to see that beyond the individual things we do in our corners, there's a lot of factors that go into digital health transformation all over the world, particularly also in Africa and Nigeria. And Ms. Olutola has actually laid the groundwork in our welcome speech. So we'll be going forward now to be getting their perspectives on this topic of the day. And I'm going to start with Dr. Akimbo, who is our internet governance expert. So my first question to you is, from what you do in the internet governance space, evolving and, the new technologies that are going on and all, and of course that's called, right, for better governance to protect citizens. How do you see internet governance evolving to support secure and equitable digital health solutions in Africa?
Okay, so if everyone can hear me, please, I would like to know. And I would also want to stop my camera to manage the bandwidth that I have. And anyone who hear me and can you see me?
Yes, I can hear you, sir.
Okay, so I'm going to stop my camera now if you don't mind. Okay, so to the question in particular, a lot has been said in the area of internet governance, and sometimes some people find it weird where digital connects with health. I remember I saw back as 2013 when we were having discussions at the West African Health Summit I held. I think that was the 11th of its kind, and a lot of people were asking the question, as stated by you, what are the things we expect to see in the nearest future? Those information that was at that point in time looking weird has now become very much obvious to the average person. A lot needs to be done when it comes to three key areas, and those three key areas are not that simple, but are very, very important for the average person to understand. One of them is policy. There is no how you would be talking about the health sector that you would not be talking about policy. Policy is key in ensuring that the average person understands where we are going to, where we are at the moment, where we're going to, and what needs to be done. And we're not talking just Nigeria, we're talking about the whole of Africa. And in Africa, so many innovations are yet to come to play its part. So, apart from the fact that we need to talk on policies to ensure that the average country in Africa begins to think borderless and say, oh, what we do in our own area It's also what should happen in other areas. And this is to the second thing, which is standardization. So that health report, the way an health report will look in Cameroon, the way an health report will look in Niger Republic, is the same way it will look in South Africa. This would enhance the digitalization of the health sector and enable or ensure that the average person that comes in within the ecosystem understands that this is the status code that we need to improve on. A lot can be said on standardization. Right now, we know we have health sectors across the 774 local governments in Nigeria, and those particular health centers are not connected. So we need to also see to the third thing, which is accessibility. And when we're talking about accessibility, we're talking about a whole lot of things. A whole lot of things concerning the amount we are able to purchase data, the availability of time or hours, which is in reference to the data you have purchased. Using Naira, for example, if you use 200 Naira to purchase data, will you be able to get enough or adequate bandwidth to be able to communicate? Just a few minutes ago, we called on one of our speakers, and we were saying, oh, probably a bandwidth connection. Even when I was responding just now, I said something like, let me switch off my video so as to be able to communicate. These are the areas you and I need to begin to pay attention to. It is when and only when we think these three key things or three core things that we're able to have a control of the digital ecosystem. And this would, of course, lay way or pave way to the emergence of more innovation. And it boils down to another question of, are we able to be within the emerging economy when it comes to digital health in Africa? Are we able to showcase what we have? Can we use what we have in Nigeria in another country? While it boils down to standardization, it also gives room for more improvement. Without taking too much of your time, I want to hand over to the moderator. Thank you. Okay, I can't hear you. Esther, I can't hear you. The mic is muted.
Goodness, I'm so sorry. I forgot I was muted. I didn't remember to unmute. All right, can you hear me now? Right. Technology gets the best of us. All right, thank you so much for that extent. And I believe what you have said has actually further set the pace, right, for the rest of what we are discussing, because you've touched on very key things. One of the first things you said, ensuring that the average person understands and of course, standardization, bandwidth, this and that, and making sure that everybody is properly aligned. So I'm going to go over now to Dr. Raphael Akombe. Can you hear me, sir? So my question to you now is, you work at the intersection of you have robust experience in the clinical space, in, of course, digital health innovation, in the health ministry, data protection officer, as a thought leader, and all of those things. And you've seen and experienced a lot. Now, from your robust perspective across these areas, what are the key components of a national digital health policy that would foster innovation while ensuring citizens' protections?
Yeah, that question is for me, right?
Yes, sir.
Yeah, thank you very much. I want to really apologize for the fluctuation of the network, the internet problem. And I'm happy that Dr. Adhpn is here. I think with his presence here, the internet is supposed to respect us, right? So I believe it's going to stay. Yeah. Answering your question, you agree with me that a well-rounded national digital health policy that actually encourage innovation while safeguarding citizens' protection should encompass several core components. And when we're talking about these components, we talk about the kind of component that support the technological advancements that promote equitable access to healthcare system. And there are some elements I'm going to mention that focuses on these areas. The first one is about the data privacy and security. You agree with me that without data, there is no industry that can function effectively. Data actually is the driving force that makes every industry to succeed. So now, and this data we're talking about must be well respected and must be protected adequately in order for us to be able to have a well-balanced operation. Now, talking about data protection and security, which is one of the points I'm going to raise, we look at the aspect of the standard, the data protection standards. I'm going to use Nigeria as an example. In Nigeria, we have Nigerian Data Protection Commission, which has brought out, the act that's talking about the law, which we all know to be Nigerian Data Protection Act, which was signed by our dear president in 2023. And of course, this must involve the implementation of stringent and internationally aligned data privacy standards, which I believe our NDPA is actually tilting towards, because we have the European standard, which we know as General Data Protection Regulations. And also we look at the aspect of the cybersecurity measure. The government of Africa will need to establish comprehensive cybersecurity frameworks, which is going to include the risk management, regular audits, that is going to keep this work effectively done. And also the aspect of the incident response protocol is also part of this that we're talking about. And lastly, I'm going to look at the aspect of the user consent and control. We know that a lot of vendors are all over, the town, and it is much more encouraged to have them. But most importantly, the vendors will have to put into their conscious design the aspect of the user consent and control. One of the problems we're facing that is affecting the integrity of data is the lack of control of our data, which must be perfectly, looked into. Number two, I will look at the aspect of the interoperability and the standard of it. I'm still going to come back to the aspect of the area of different solutions that we have in the market today. The question we need to ask ourselves concerning this solution is that, this solution have the capability to be able to have handshake with other solutions? Would they be able to have the recognition of other solutions in order to, to promote seamless activities between one facility to the other? So that interoperability and the standard is very, very important. Where we need to look at the unified standards, you need to look at the aspect of unified standard, that is developing the unified technical standard to ensure that all digital health systems are interoperable. This is very, very important. And of course, we need to also, look at the aspect of this, making this data that we're talking about to be seamless in a situation whereby when this information, this data is being used, it will be easy for them to be used across healthcare providers. Let's
Dr. Raphael, are you still with us?
we look at the aspect of the incentive.
Seems to be battling some internet issues.
Put it in place in ensuring.
Hi, Dr. Raphael. Okay. Okay, so sorry about that. Seems the internet is really on our case today, as we usually say in local parlance. Well, he has already stated quite a while, and I particularly like one of the last things he said, which pertains to, making sure this data is interoperable, seamless, and so on, and everything like that. Now I'm going to move on while we wait for him to get back into the room. For the sake of time, I'm going to move on to Victor Emaye for his own question. And it's very apt that he's even speaking after Dr. Akongwe, because you'll be able to speak to us from the perspective as an innovator, right, or founder of a health tech startup. So what are your biggest challenges you faced in developing and scaling digital health solutions within the existing regulatory frameworks that we have? Over
Yeah,
to you.
thank you very much, Esther. It's such a great pleasure to speak after Dr. Adhpn and Dr. Raphael Akongwe. I think that they've laid a very great foundation to the work that we do at Checker and other startups in the healthcare ecosystem. I'm sure that everybody will agree with me that the way most of these innovations come up, whilst they're very good, we most times build in silos, right? So there's not so much collaboration in the system, and this has led to less interoperability, so to speak. You would imagine there's a telemedicine solution here, there is an EMR here, there is a digital diagnostics platform here, and everybody is building in silos. And I think that the government has got a great role to play in this space. Let's just imagine that scenario where we've got a very good, massive digital health infrastructure from the government, right? You would see that it will be easy for anyone to plug their solutions into what is already existing and fly from there. It will create access to markets, it will create access to collaborations, it will create access to even increase revenue and opportunities to really scale your solution without having to build everything. A telemedicine solution should be a telemedicine solution because you've got digital pharmacies that you can integrate with. You've got digital diagnostics companies that you could integrate with. But if you launch a telemedicine solution today and you're not able to launch it out properly because there's also a part for diagnostics, there's a part for pharmacy, right? So there's increased need for collaboration in the healthcare space. Another part is, of course, the complex and ever-evolving data privacy laws. So today there's a new policy, tomorrow there's another policy, and sometimes it's very difficult to catch up with some of these information. So many at times they lead to information asymmetry. Imagine there's a new policy out there, and as founders of digital health innovations, we are not aware of them. So whilst the government are trying to put so many of these infrastructures and policies in place, it would be good to also create massive awareness for them. It just creates an enabling environment for every player in the industry. Another thing is balancing innovation with regulatory constraints, right? You will see that there are a lot of innovations coming up. With the advent of AI, I'm not sure if any of our policies has anything relating to AI currently. And I feel that whilst we're building policies as a government, we should also build it futuristically, right? Because the way technology is evolving is faster than we can even catch up. So a very robust framework is required, such that once solutions in digital health come up, we can just plug in, like I said, and also be aware of whatever restrictions we might have. And whilst I think Dr. Raphael spoke about data privacy laws, and you would see that a lot of us are not aware of some of these things. And even while we're aware, because of even getting an NDPR certification for a startup that's barely raised funds is something, right? So one thing is understanding the law, now understanding what it costs to be compliant, right? So there are different bottlenecks to these challenges. And whilst you understand that the government and the different ministries and agencies are working assiduously to catch up with the ever-evolving technology landscape, it would be good to have more collaboration and check between the government and, of course, these organizations that are in the digital health space, such that, I mean, they can collaborate in creating policies. It's not from head to the top, but it's an handshake, and that just creates that very dependable ecosystem for digital health creators and innovators. Yeah, thank you.
Thank you so much. Thank you so much. I love that you highlighted specifics, and I'm sure that some of the people in the room, I think I noticed a couple of people who are also founders probably relate to some of the things that you have highlighted. So I'm going to come back to Dr. Adhpn, right? And so we've talked about interoperability, health information exchange, all of those things and all. So with many digital health tools that require cross-border data sharing, what specific governance policies or standards are needed to ensure privacy and security in a multi-country context, especially knowing that across borders, there are probably some distinctions as well in the governing laws as regards data sharing and all that. So that question, and also how to navigate those bottlenecks.
Okay, thank you so much. The previous speaker, Dr. Victor, was trying to lay ground. Am I right? Okay, Dr. Russell, am I right? I was trying to lay ground to the issue of data protection, mention the issue of interoperability. These are key elements to ensuring a multi-country approach. There will be challenges anyway, but if we look at privacy and security of sensitive health information, we can be able to harmonize a framework that is essential to responding to the issues of data protection and privacy law when it comes to comprehensive data protection law, cross-border data transfer regulation, consent mechanism, like we were trying to say in the area of being fair and taking permission, being transparent about consent, the issue of consent from individual. I have an issue of cancer, and there is a doctor that wants to get access to such an information. I must have a process whereby a token is generated from the individual. Maybe I am the individual. I have to give that doctor that token before he or she, from anywhere in Africa, and be able to have access to my details in the area of consent mechanism. Don't forget, I've also mentioned within this particular scenario what we call the cross-border data transfer regulation. Are these regulations existing? If they are not, then we should begin to pay attention to such as elements of a comprehensive data protection law in the area of multi-country approach. Don't forget, there is the issue of data privacy, always mentioned over and over, either from the domestication of the GDPR. Different countries have domesticated GDPR. We have our own here in Nigeria. We even have a commission and the commissioner for data privacy issues. And I hear the first speaker mentioning the issue of, there was a word, the ability to get a DPO, maybe because of the process. I know the data protection arm of the Nigeria is trying its best to get more DPOI there and getting the certification very easy, but it is true that we must understand data minimization and its standard. And if we are talking cross-border, we are talking multi-country, standard is key. Standard is key. What is the standard in one country in Africa? What is the standard in South Africa, Ethiopia, Nigeria, Kenya, Rwanda? We must speak about standards. And when we are looking at standards, we must not forget that in between, there are people who are working within that cross-border. If we want to call it a borderless Africa, for digital health for the borderless Africa, digital health for the borderless Africa. We must begin to measure that the people in those countries, we have to come together and speak the same language. Speak one language, which is health in a very simple manner. And of course, those people must respect ethical guidance. Ethical guidance will form a framework or a platform for a strong multi-country approach. Because once you understand that there are principles that you must fall in line with, informed consent, in line of fairness and equity, you will begin to say, oh, this is possible for the average African country to agree on as a policy, as a key measure to ensuring that we are in line with a multi-country approach. Of course, I do not want to take our time because we cannot finish the issue of interoperability. Excuse me. We cannot finish the issue of interoperability. And we cannot, there's no measure that we can use to discuss common data standards, which we now have to rally around other countries in Africa, and about even outside Africa, if we want to maintain a standard that allows for secure exchange of data. Because if we are saying that the Europeans have a measure for exchange, what is the African measure for exchange, data exchange, or data exchange protocol? These are discussions that we must build upon to enable us to be able to address the issue of identifying different gaps and being able to get best practice in regulatory measures. So what I mean, it's an Africa that has a solution that goes across border, allows for sharing based on governance policy or standards to ensure the privacy and security of different countries in question. I also do not want to take too much of our time to quickly state this particular issue when it comes to addressing challenges and future directions. That is the issue of international cooperation. Yes, I've mentioned it briefly that we must look beyond Africa and then we must look towards the sustainable development goals that keep hammering on the word partnership. Partnership. That has gotten us to where we are today. Partnership with different organizations, partnership with experts. I recall that the last speaker was mentioning that he is coming from an organization that has tools. What are those tools? Those tools meet international standards. How best do we, across countries, begin to measure the content and then say, adopt this against all standards. Adopt this because it meets that partnership. Adopt this and begin to say that there are 4 people to build on when we are adopting that particular standard. We must understand capacity building is important. We must understand the average bystander must be aware or informed or educated about this particular issue in question. We must not forget that dicey or very shaky leg of the internet that speaks to trust and transparency, because there are, of course, espionage across countries. So a digital warfare in the health sector would actually spell doom to one other country. So we must never forget that. And finally, we must not forget that continuous evaluation and adaptation. There will be changes. There will be emerging digital tools. There will be discussion on safety. Safety will never stop being a key issue for discussion. Madam Moderator, I hand over back to you. Thank you.
Wow, thank you so much. Inadvertently, you have actually even spoken to some of the questions that I would have asked as a follow-up. And wow. So thank you so much for sharing. So I'm going to come back to Dr. Raphael. So in what ways can governments and government agencies, as the case may be, work with private innovators to scale digital health solutions while maintaining regulatory oversight? I know Dr. Adhpn would have spoken to some elements of it, and Victor as well. From your own perspective as someone who is at the interplay, what are those specific things they can do specifically, right, to really make things happen?
Thank you very much. I want to appreciate the last speaker, Dr. Adhpn. Like you rightly said, most of the things that I would have loved to see even say, he has mentioned there. And of course, he made mention of a public-private partnership, which is very, very important. And what we need to know is that government agency can collaborate with private investors, and innovators in order to scale digital health solutions effectively by establishing partnership that combines the strength of the public and that strength of the private sector, just as was said by Dr. Adhpn. And this approach can actually stimulate innovation while we are ensuring regulatory oversight in order to protect the users, maintain the data privacy, and ensure the reliability of health solutions. And of course, just like I said earlier on, Dr. Adhpn has made mention of PPP, which I don't want to go into. Another aspect that we can actually look into is the establishment of innovation sandboxes with regulation standard, which is very important. And talking about the sandboxes, this will create innovation where private companies can test new digital solutions in a controlled environment with a relaxed regulatory requirement, which is actually going to make this work to be much easier. Then also we look at the aspect of the real-time regulatory feedback, because there is one thing for you to create a regulatory standard. Another thing is for you to have a real-time regulation standard, which will provide regulatory guidance, during the sandbox phases. And this is going to help a lot of companies to understand and incorporate compliance requirements early in their development processes. And of course, this is also going to make them to scale up, effectively. Now, also, I will look at this aspect as well, because I don't want to repeat what Dr. the doctor have just said earlier on. The other area we need to look at is the creation of interoperability standards and compliance framework. This standard is what we've actually been talking about. And until we get it right in African continent, there is no how we can actually meet the need that we are expecting. So one of the problems we're having in this continent is that we have a lot of innovators, but the government is not really giving support. But I am so happy the way the government has been coming up now in formulating policies that is really going to give us a way of direction into this, whereby the standardized data and the interoperability requirements that is going to make things to work both for the private innovators and the government, in order to set data standard and interoperability guidelines for the vendors and the users, ensuring that digital health solutions can integrate seamlessly with existing healthcare system. We know that a lot of things have been going on in the healthcare system, and of course, there are so many new innovations coming in now. But the question we need to ask ourselves is that, are these innovations able to, to integrate with the old system that is on ground? I have seen a lot of solutions, in different places, and of course, a lot of people are really trying. So we need to get this thing right. Another area that I want to look into under this creation of interoperability standard is the certification program. There is a need for government to develop certification program that will test and approve private sector solutions. This is very important for compliance and also for national health standard. And once this organization have been certified, this solution can be deployed widely with public sector endorsement. A lot of people are coming up with different kind of solutions, but there is no particular location, a particular area, that particular law that is going to certify that these solutions are up to standard. For example, in Society for Telemedicine and E-Health in Nigeria, which happen to be one of the board of directors there, there are a lot of work that we have been working on now. We are working in line with WHO, we're working in line with Federal Ministry of Health, and in order to set these standards so that things can work effectively in Nigeria and also in other parts of the world once we emulate this positive aspect. Now, encouragement of open data collaboration. Sorry, I'm going to round up now because I know time is not on our side. Encouragement of open data collaboration and data privacy protection is also a very, very important aspect of it. Talking about the data sharing agreements, then API access for public health data, and also collaborative analytics. Now, talking about this collaborative analytics, partners with private companies in analytic projects in order to extract insights from health data, while ensuring that government oversight on data privacy and ethical use of data is very, very critical. So there are so many other areas I want to really talk about. That is talking about the support private sector's capacity in building with government enterprise, which is one of the, the platform that the Federal Ministry of Health in collaboration with WHO have just, started already. The telemedicine guideline framework that is ongoing is one of the very robust aspects that is really going to change the face of digital health in Nigeria. And once this has been fully established and it is passed to law, things will get normalized as far as this country is concerned. Also, implementation of a transparent procurement process is another area. Then also, I just remember something now, collaboration on ethical and privacy standards. For new technologies, there are new technologies that are coming up. We're talking about AI in healthcare system. You know, there are a lot of new things that are coming up now, which we need to really look into effectively. That is talking about the joint development of ethical guidelines for emerging technologies, and also artificial intelligence and privacy task force must be established in order to guide the usability, the operability of all these solutions. Also, lastly, let me just, lastly, so that at least I don't waste much of our time. Lastly, engagement in outcome-based performance, you know, is another very important aspect I want us to look into. That is, this is going to, you know, establish the outcome-based metrics that will track health impacts, patient satisfaction, and the cost effectiveness. This is very important, and also the national scaling based on proven impact, and also the long-term monitoring and evaluation that we need to really put into consideration. This is going to bring a lot of transformation in our system. And by continuing to monitor and evaluate digital health solutions, even after the scaling process, we allow for adjustment based on changing needs, and also the regulatory updates is going to be involved, and the technological advancement is going to be embraced. So these are part of the things that we just need to look into. And you know, in order not to create time, because I've really, you know, wasted some time during the time of internet problem. So let me just stop here. Thank you very much.
Thank you so much, sir, for that extensive one. I'm going to just, we're almost out of time. And again, a lot of you have actually spoken to some of the follow-up questions I already had. So I guess I would say thank you so much for that. So early on, a lot of the conversation has focused on what the government can do, what agencies can do, and all that. Now, I'm going to ask you, Victor, how can digital health innovators work proactively with policymakers to shape regulations that support both innovation and user protection? So I want to look at it as from an holistic direction, right? How can you also influence the ecosystem and also meet the requirements that are needed, right, to ensure safety and innovation on all ends?
Thank you for that, Esther, and thanks, Dr. Raphael, for the very extensive insights that you've shared. So to respond to your question, first is most healthcare innovators and founders need to really work with these regulatory bodies from earlier on, right? You would see that from my own experience, I could recall that I had this event with the was it the NDPR? Yes, so no, that was the NDPC, right? Nigerian Data Protection Commission, and I got a lot of insights into the data privacy laws. I even got a certificate, and this was it just helped us like build a very solid relationship from the get-go, right? So there's a need for health innovators to really establish great communication with some of these regulatory bodies like the Federal Ministry of Health, or the NHI, which is the Health Insurance Authority, or even the NDPC, right? And even ministries and agencies alike in the healthcare industry. This will just help to bring forth that great collaboration, and you get to get information even ahead of time. You would see that Dr. Raphael spoke about regulatory sandboxes, right? So there's a need for so many of us as founders and innovators in the healthcare space to participate in many of these regulatory sandboxes and pilots, right? So it just helps us to stay involved and see how we can test some of these solutions in a very controlled environment, right? Without the burden of full regulatory compliance. So if we can have these regulatory sandboxes and have so many of these innovators participate in them, it will solve so many problems even beforehand. For example, being a part of industry associations and advocacy group, I like the idea of the African Digital Health Professionals Network or the Digital Health Africa Network also. It's a very good association or group to be a part of, because I mean it sort of just provides that access to advocacy, right, with the government. And I mean, you even putting this together, it's one way to solve the problem, right? Creating that symposium to communicate across board, right? Our founders on the call have digital health experts and even the government involved. This just really helps us to foster that great collaboration and thereby creating that atmosphere to even educate ourselves, right? My next point will be around educating policymakers on emerging technologies. Like I said, you will see that technologies emerge very quickly, right? So digital health innovators would really help to bridge that knowledge gap, right? From maybe their presentations to reports on the work that they do and data that they can garner that would show what exactly is going on in the healthcare space, even at the grassroots. So many of this information that even the policymakers might not be aware of, because we are the ones that really play at the grassroots. We are able to educate makers on the different technologies that exist and of course how it's really playing out. And this would help provide evidence-based insights into the work that we are doing and how it can help the continent on a very broader scale. Like, so here are some of my insights to that question. Thank you.
All right, thank you so much. Thank you so much for that. I hope that everybody in the room is concerned with that, are also like taking notes, or even in the audience also, you know, picking up one or two things that will be relevant in their own work outside of this space. So now, finally, we have already reached the end of our conversation, and I would like to go through all of the speakers with one last question. It's a general question, but I want you to speak in line with your own perspective. And also, even if it's something that maybe summarizes some of those things that you've already spoken to before, or a new point that you were not able to add before. And the essence of this is, picture it this way: if nobody would remember every other thing that you've spoken about today, one thing you want them to remember, right, as regards our conversation today. And the question for everyone is, I'm going to go back to start from Dr. Adhpn, which is, from your perspective, what are the most critical components of a conducive environment that can support both innovation and digital governance in Africa's health sector?
Thank you for that question. You said a take home and something that is critical for us to pay attention to. That is the area of multi-stakeholderism. My apologies for the background. I just finished an global institution. That's why I'm within this particular environment. However, the take home is multi-stakeholderism. And what do I mean by this? I mean people from different sectors with their level of skill, with their expertise, coming together to agree on how best to address all the challenges that we are facing at the moment. And how best can we address all these challenges? If not to look at first the challenges itself, then begin to look at the innovation in question as it agrees to best practice, and then finalize it with one word, that together we can build a borderless digital ecosystem that ensures global attractiveness and local attention towards an internet for everyone. Thank you.
Thank you very much, sir. Over to you, Dr. Raphael, please. The same question. Do you need me to repeat it? Hello?
Yeah,
Okay.
hello. Sorry, please. I was just struggling with this microphone. Yeah, you don't need to repeat it at all. Just let me just toe the line of Dr. Adhpn. What I just want the participants to know, I know everybody have the mind for super health care technology, spirit. And I'm just going to, talk to us that we should try and see how we are going to expand the access to healthcare through technology. And how do we do it? We need to start thinking indigenously. We need to start thinking about building our own application from home, not relying on the third-party application, which is so rampant today. We have a lot of highly tech, minded, youths around today that can be put together to build something that is going to bring about the rich culture of Africa, that will speak the language of Africa, that we understand our culture, not imbibing the culture of other country that is not in alignment with our own. This is one of the reasons why we are running into crisis. By the time we start building our indigenous work through this, it is going to expand the access to our healthcare system, and also telemedicine and mobile health is definitely going to be enhanced as well. And the health information portability, that's talking about the EHR, which allows patients to access the information from any location, is going to be highly robust. And governments coming into this in ensuring that the adequate law is in place to follow is really going to single-handedly make Africa to come out as one of the best in the world. Thank you very much.
Thank you so much, sir. Thank you, thank you, thank you. Definitely, African perspective must be put at the fore in making of. So, finally, Victor, please.
Oh, yes. So I'll throw the line of Dr. Raphael, right? What's the essence of creating very innovative healthcare solutions if we do not have that enabling environment? So let me call it a two-edged sword. One side is there's a huge need to create fantastic access to internet, right? And on the other side, there's another need to ensure that the infrastructure that encourages interoperability is available. Let's have it such that managing healthcare data is from the government and everybody is pulling from that same pool. If you're doing telemedicine, EMR, digital pharmacy, using so many of these global, or let's say institutionalized kind of systems that would encourage collaboration, right? I think that would make us adopt digital health in Africa very quickly and will help us scale at a very huge pace. So I'm encouraging collaboration across board, whilst also encouraging that we provide access to diagnostics, doctors, telemedicine, and all the digital health services that are available across the continent, with, of course, access to internet, because anything that is digital requires good internet availability. Yeah, thank you very much.
Thank you so much. Thank you, thank you, thank you so much, everyone. And to everyone who has listened as well, thank you so much for your patience and your interest in this conversation. It has really been encouraging. I would like to ask if there are any questions. I had asked earlier if anybody has any questions, and they can go ahead and drop. But actually, we're actually already out of time to anyway, but just if we could take one or two. But I see that yes, definitely. The recording will be shared with the registrants, which will also be on our YouTube channel and of course on social media. We are going to share the links to all of that. Again, we understand a lot of people actually registered, but probably they couldn't make it by this time. So they would be able to catch up on what was discussed. And of course, I thought it was just me who thought that, but obviously from the lack of questions, we can see that our panelists did a great job on addressing everything that was raised here today. Thank you so much, Victor. Thank you so much, Dr. Adhpn. Thanks so much, Dr. Raphael. Thank you very much for everything you have shared. And I also believe that everyone who has listened here has picked one or two things to act upon. Again, this is not a competition to know how much, how many conferences we've attended or webinars or networks or whatever it is that we've attended, but really to gain things that we can take back home and apply to our personal lives and work, right? And also share with others as well, because at the end of the day, our goal is to improve healthcare in Africa and of course all over the world by extension. And with that, I would like to give an official call to action that we all should reflect on everything that has been discussed and act on it, right? Let's do the things that we can do within our own spheres, or maybe research further, contribute more, apply as much as we can at any level that we can, and of course, join in advocating for better policies, better frameworks, better implementation, and sustainability. Again, so our speakers are already dropping their social media handle if you want to connect with them outside of this conversation. So please feel free, reach out to them on LinkedIn, reach out to them via any platforms that they are comfortable with. And thank you again to our audience as well. Thank you so much for joining in. And once again, my name is Esther Opone, and I am the president for Adhpn. It's been a great honor to host this conversation, and I look forward to doing great stuff together with everyone. Thank you so much, everyone, once again for the last time, and take care. Bye.
Bye,
Oh,
Madam
I'm so
President.
sorry. Please feel free to share insights from what you have learned on LinkedIn and use the hashtag Digital Health Week 2024 ADHPN. You can tag us, African Digital Health Professionals Network, on LinkedIn, DHA Africa, and of course, our panelists. Thank you so much. I'm just going to go ahead and drop our LinkedIn profile.